Could you tell us that story about your cousin, was it?
Yeah, you know, my cousin was a guy that lived with me, and at the time, me and my wife, and fairly traditional guy, and he was let's see, what did he do? He was a nurse, or he was something in the medical field. I can't remember now, it's been so many years ago, but you know, he was diagnosed with Hodgkin's lymphoma. So when he was diagnosed, you know, he was immediately referred up to Duke, and so of course Duke diagnosed him and staged him in, you know, lymph nodes and all of that, and said, you know, here's what we recommend. But you know, being a traditional guy, I mean, he really wanted to talk to some of the traditional healers around here about what his options were, and some of those guys recommended taking a more traditional route, talked about herbal treatment and natural remedies and stuff like that, and he debated it for a while. I mean, he had to kind of make a decision, you know. I mean, it was kind of, couldn't wait a long time, and he called me. I seemed like I may have been in Oklahoma at the time, and we just talked about it, and I kind of tried to feel it out and gave him my advice, and I think, you know, at the end, and I kind of said it this way. I said, you know, do you feel like you personally would have a conflict if you actually looked at both avenues together? And he said, well, I don't personally, you know. And then I think what he did at that point is went back and talked with both sides, the traditional healers and the folks at Duke, and you know, that's what he ended up doing. So and I think it helped him. I mean, again, he eventually passed away, but you know, sometime in medicine, it's it's going to sound a little odd. It's not even what the outcome is. It's how you personally or spiritually handle, or medically, whatever the health problem is you're dealing with. I mean, you have to feel comfortable with whatever that route is, whether it's Western medicine or traditional medicine or blend of both, or Duke, or I'd rather go to Duke, I'd rather go to Chapel Hill. I mean, you have to feel comfortable in whatever, you know, whatever capacity it is that you're dealing with, whatever the health situation is, right? Because we know, I mean, you know, you know, there's been experiments that talk about faith, how, you know, faith can impact health outcomes. So it's all, I mean, a lot of it's right here. It's right here. So I think it's important for us as providers to kind of understand the health problem in the context of the community in which it's going on, and understand what those practices are. That way you can relate to parents about, you know, what your options are, and how they can feel comfortable moving forward. Because some of what we deal with here, even though, let's say it may not be life-threatening like my cousin, it's still chronic. ADHD is a good example. You know, this child we talked to and evaluated this afternoon may have ADHD into adulthood. We don't know, right? So, you know, so they need to be comfortable with whatever steps along the way they want to take about treatment.
What do you do when a patient or a friend or anyone doesn't feel educated enough to make that decision on their own?
That's a good question. Here's what I do. If somebody comes to me and says, Dr. Bell, you know, I hear what you're saying about different options, but I just can't make a decision. Tell me what you think. I'll say, okay, here's what the medical studies show. And I'll say, you know, if you look at the medical studies of, let's say ADHD, treatment ADHD, you know, that medical studies show that treatment with prescription medicine, or treatment with prescription medicine plus behavioral therapy, gives you the highest level of success. Then the next level is just behavioral therapy, and then anything after that. I said, so that's what the medical studies show, but now you have to feel comfortable with whatever treatment we do. And usually once parents have a little bit better understanding of that, they're a little bit better informed to make a decision. So.
How often do you see, like with the Christian practices? I know like there's a distinction sometimes between traditional practices and Christian practices.
Yeah, and then sometimes they blend.
Yeah, sometimes they blend.
They do, yeah. Yeah, we see that, and you know, we sometimes even we'll have prayer in a room.
Yeah.
We'll have prayer in the room. You know, again, it can be powerful, and I think, you know, around here especially, you know, Christian faith is strong. You know, the church is strong. It's a big part of community and families, and so you know, there's a lot of spirituality involved with community health here. You know, and you'll hear parents saying, you know, Dr. Bill, pray for us, or I'll say, you know, I'll pray for you, or, you know, we took him up to the altar last night. They laid hands on him. I feel like he's better. You know, I mean, that's common. I mean, you hear that all the time. And, you know, and I think it's because I believe it does make a difference. I think it helps.